series. And today's webinar series is brought to us by the Africa Respiratory Care Association, and it is proudly sponsored by Zopec Medical. Zopec Medical designs advanced hospital-graded power solutions, that is the UPS battery system that ensures uninterrupted power for critical respiratory and neonatal equipment. Now, these batteries ensure seamless patient transport, support early mobility, enhance physical, occupational, and respiratory therapy while transporting the patient from one unit to another or from one facility to another. It is user-friendly and safe, and it has visual and alarm systems in it, and it is compatible to all electronic devices or electrical devices that will support patient while transporting the patient. Now, for more details on Zopec Medical, you can contact Zopec at info@zopec.com, or you call them directly on +1 888 468 7108. Or for more details, if you want to reach Africa Respiratory Care directly, you can reach us on info@africaresp.org, or you can WhatsApp or call +1470 357 3590, and then we would sort you out. If you are in Africa, we have a country rep, so you can contact the Africa Respiratory Care Association, and then we can direct you to the representative or the agent that will help in supplying of these uninterrupted power systems. Zopec Medical. Their motto is powering critical care mobility with confidence. And today, we have an amazing personality coming to present to us and teach us. She is, before I go on, I want to just say something brief about this person, and then we can get. Guinea is located in West Africa. That is a country in West Africa rich in cultural heritage, diverse ethnic group, and has beautiful landscape. Now, the nation's flag, which features the red, yellow, green, symbolizes unity and natural resources and hope for a prosperous future. Now, Guinea is also a home to incredible landmarks like the Mount Nimba and Futa Jalon regions, showcasing its natural beauty and rich biodiversity. Beyond its cultural vibrancy, Guinea faces significant healthcare challenges, particularly in respiratory care. This is a critical need for awareness, training, and infrastructure to address respiratory diseases and related conditions, such as the pulmonary hypertension, which continues to impact many across the country and also the continent of Africa and at the world at large. Today, we are privileged to have in our midst Ms. Binta Diallo. She is the country director for ARCA in Guinea. So she is the Guinea country director, leading this important mission in Guinea. She is a licensed respiratory therapist with over 13 years of experience in acute and long-term settings. She is currently working at Innova Health System in Virginia, USA. Binta has been in the forefront of ARCA's initiative in Guinea, working tirelessly to raise awareness and to improve healthcare training and foster better practices in the country. So she's ensuring that respiratory care in Guinea is enhanced. In today's webinar, Binta will focus on pulmonary hypertension. She takes us through the causes, symptoms, importance of raising awareness about pulmonary hypertension, not only in Guinea, but globally. So let's turn our attention to Ms. Binta Diallo as she presents on pulmonary hypertension. So Ms. Binta, your audience, our presenter. Thank you.
Thank you so much for this wonderful introduction, and thank you all for being here and listening to us. And I hope you all gonna have a good time with us here. So I'm Binta Diallo, as you said, I'm a respiratory care practitioner. So I did some little research on pulmonary hypertension. So I know we have non, healthcare providers and healthcare providers. So we make the word easy instead of medical term, so we all can understand the content of the pulmonary hypertension. So thank you so much again for being here. So before I talk about the pulmonary hypertension, I would love to bring up to your attention the four life functions that affect, of course, pulmonary hypertension is affected by them. The four life functions are the functions we need to survive, right? So to live. The four life function, we have pulmonary hypertension, no. We have ventilation, we have oxygenation, we have circulation, and we have perfusion. So we need all those four in order to live. So pulmonary hypertension, if you follow us, you will see is affected by all ventilation, of course, the movement of air in and out of the lung, oxygenation, circulation of blood circulating in the body, and perfusion. And our organ need to perfuse in order for them to live, such as the brain, the heart, the lungs, the liver, everything. So before that, now I'm gonna hit the pulmonary hypertension. So what is pulmonary hypertension? Pulmonary hypertension is a condition characterized by abnormally high blood pressure in the pulmonary arteries, the blood vessel that carry blood from the heart to the lungs. So this increased pressure forces the right side of the heart to work harder, potentially leading to heart failure and other complications. So pulmonary hypertension, again, is caused when the arteries in the lungs become thickened and narrowed. This blocks the blood flow through the lung, which raises the blood pressure in the lungs and causes the heart to work harder, especially the right heart, to pump blood through those thickened and narrowed arteries. Over time, the heart loses the ability to effectively pump blood throughout the body. So, and we have the right side of the heart that affected. The right side, sorry, let me move this. Oh, sorry. Okay, the right-sided heart failure, or called pulmonate, is an enlargement of the right ventricle due to high pressure in the lung, usually caused by chronic heart and lung disease, such as left-sided heart disease or heart failure, congenital heart disease, chronic obstructive pulmonary disease, COPD, interstitial lung disease, ILD, chronic thromboembolic pulmonary disease, pulmonary embolism, obstructive sleep apnea, and sarcoidosis or other granulomatous disease, and smoking, of course, tobacco use. Okay, oh, sorry, my thing. So why pulmonary hypertension matters? Pulmonary hypertension particularly refers to high blood pressure in the lung. It's different from common high blood pressure, hypertension we all know, the systemic blood pressure, which affects blood vessel throughout the body. Okay, we continuing why pulmonary hypertension matters. Pulmonary hypertension is not limited to any particular age group. Although it is more common in adults, in those with pre-existing heart and lung condition. Pulmonary hypertension affects neonate, which we call persistent pulmonary hypertension, PPHN, in newborns. And pulmonary hypertension affects children, like pediatric children, and it affects older adults, older population. Sorry, why pulmonary hypertension matters, again, is the epidemiology of the pulmonary hypertension. pulmonary hypertension is a global issue with a prevalence of about 1% of global population, increasing the 10% in individuals over 65 years. While all ages groups are affected, the way of the disease is significant in older adults, especially in developing countries where infectious diseases such as HIV/AIDS and tuberculosis are significant pulmonary hypertension causes. However, in many parts of the world, left-sided heart and chronic lung disease are the most common cause of pulmonary hypertension and is associated with increased mortality risk, and if untreated, can lead to progressive heart failure, eventually death. Global prevalence and incidence rate is still why pulmonary hypertension matters. The pulmonary hypertension is associated with increased mortality rates in both developed and developing countries. The Institute of Health Metrics and Evaluation, IHME, estimate that in 2021, there were 192,000 prevalent cases of pulmonary hypertension globally, with most cases in females and older adults. How pulmonary hypertension present? What are the signs and symptoms of pulmonary hypertension? Pulmonary hypertension starts with shortness of breath, like any other disease in the lungs. Anything happening in the lungs, the first sign most of the time you can see is shortness of breath. Often it starts during exercise and may progress at rest, so limiting the exercise capacity. Fatigue, persistent tiredness, and general lack of energy. Chest pain may be experiencing has a squeezing or pressure in your chest, in your heart, right? Swelling. In late stage, you have the ankle, leg, and potentially the abdomen due to fluid overload, accumulating all that fluid. Disease and fainting may occur due to heart increased workload and decreased blood flow to the brain. I am just moving this. So diagnostic, how we can find we have pulmonary hypertension. Pulmonary hypertension is diagnosed using a combination of clinical evaluation, non-invasive imaging, and when necessary, invasive procedures. A right-sided heart catheterization is a gold standard for diagnosing pulmonary hypertension, but we use echocardiography and other tests help guide the process. Some of them are right heart catheterization, of course, echocardiography, chest X-ray, electrocardiogram, blood test, pulmonary function test, and the 6-minute walk test. We have treatment options for pulmonary hypertension. Pulmonary hypertension treatment aim to manage the symptom, slow progression, and improve quality of life. Although there is no cure for pulmonary hypertension once you have it, treatment options vary depending on the underlying cause of the severity of the pulmonary hypertension and may include medications like we have non-pharmacological and pharmacological to manage this disease. So medication, we have medication, oxygen therapy, surgery, and lung and heart transplant. And the medications, pharmacological medication, we have vasodilators, such as nitric oxide or ibuprofen. We have diuretics to help, of course, decrease the fluid in your body. We have blood thinners to avoid embolism, blood clot. We have oxygen therapy. We have pulmonary rehab, which is a non-pharmacological, but they can help manage your disease and live, with your daily activity living. We have surgery for lung and heart transplantation, and we have lifestyle changes. Ventilator support consideration. Once pulmonary hypertension becomes critical, in critically sick patients with pulmonary hypertension, mechanical ventilation should be used. Ventilation lung protective strategies should focus on reducing right ventricular afterload and improving right ventricular perfusion. The interdisciplinary team collaboration, my favorite part of my job, working with all the providers in the hospital, like coordinating care, is very important to reduce patients' time in the hospital, or preventing readmission too. So the interdisciplinary team collaboration is very critical. Even though you can see individual going in and out in the patient room, doing their own thing individually, outside the room, we all collaborate. We all communicate for the best outcome of the patient to provide that excellent and safe care. So the interdisciplinary team collaboration, like doctor collaboration, such as doctors, respiratory therapists, nurses, pharmacists, case managers, physical therapists, speech therapists, and occupational therapists. As you know, everything, all of them, everybody is important. But again, respiratory therapists are the best. Sorry, my friend nurses. So respiratory therapists manage patient oxygenation and ventilation, of course. Nurses are there to manage the circulation. We talk about perfusion, making sure everything is going in the right direction. And the case managers are there to making sure, patient can have a place after the hospital if they need rehab or they need to go a long-term care. We have physical therapists that help. Once you are in the hospital, sometimes you lose your muscle, strength. So physical therapy is very important to help you get your strength, especially now. You can see we walk patient on the ventilator. We make that we walk for that, bringing that strong muscles back. We have speech therapists. They help patient get back to their speech, and especially trach patient after a trach, post-trach patient and all, or stroke patients. We have occupational therapists that help you, put on your clothes, how you feed yourself again. Just all that is help the patient get better and get where they're supposed to be, get their activity of daily living. And all healthcare team are very important in this interdisciplinary team collaboration. So we have the optimal care for the patient with pulmonary hypertension. They all coordinate together to diagnose, manage, treat, and support to improve patient outcome and enhance their quality of life. Now, comprehensive care. The interdisciplinary team can address the physical, psychological, and social need of patients to promote holistic approach to care. Shared decision making. All team members collaborate to develop individualized treatment plans. As you know, each patient is different, so it's not one size fits all. In treatment, management, everything depends on the patient's underlying cause, disease, and the stages of the pulmonary hypertension. So we collaborate to develop individual team plans, ensuring patients are actively involved, very important, in decision making and ensuring that patients receive the best care. And okay, sorry, let me go back. Okay, no. Oh, sorry, the PowerPoint, yeah. And the patient is ensuring that patients are receiving consistent and coordinated care. The importance of respiratory therapy teams in managing pulmonary hypertension is very important for respiratory therapy to be involved in any lung disease. The pulmonologists, respiratory therapists cannot be out of that treatments. So to help patients, reduce patients' number of days in the hospital, in the ICU, on the ventilators, on oxygen therapy, respiratory therapists are involved. They need to be involved. They need to be at the patient care during that time. Doesn't matter which disease they have, especially pulmonary hypertension, which reduces again their number of days on the ventilator and number of days in the ICU, the hospital, and preventing them from readmission too. You can see respiratory therapy has clinician at the bedside, has educators, has clinical specialists. Nowadays, we are everywhere helping all that, preventing patients from readmission again or getting out of the hospital as soon as possible. So that's one of the mission. Again, I want to bring that up, the mission of ARCA. ARCA's mission is to make sure respiratory therapists are involved in any respiratory treatments in Africa, especially right now, because respiratory is well known in America and well respected and valued, and in Canada, but not in Africa. We don't know much about respiratory therapists. Many people didn't know about it until COVID hits. So now the mission of ARCA is to make sure government Africa open respiratory care schools, 4-year program in their universities, train people well so they can be in the hospitals and manage respiratory disease. So one of the mission is that. ARCA is fighting, ARCA is pushing it, ARCA is working with government, ARCA is working with every country in Africa, and we advocating it to making sure people have healthy lungs and they are treated by respiratory therapists, by the expert, by the trained people, by all respiratory therapists everywhere in Africa. And thank you to Ghana, of course, and Egypt and everywhere that training respiratory therapists. So that's the mission of ARCA. Again, respiratory therapists play a critical role in managing pulmonary hypertension, a life-threatening condition. RTs are very important in diagnosing, treating, educating patients with pulmonary hypertension, particularly in the ICU where respiratory support is often required. RTs assist in evaluating patients, administering inhaled pulmonary vasodilators such as nitric oxide, providing ventilation, monitoring oxygen level, as well as providing respiratory therapy to improve breathing and help improve their patient's quality of life through pulmonary rehab as well. So again, anytime we have pulmonary disease, pulmonary issues, make sure the pulmonologists and respiratory therapists are involved. It helps a lot with patients with pulmonary disease. How we can prevent pulmonary hypertension? While not all pulmonary hypertension can be prevented, you can take steps to prevent it by adopting healthy lifestyle changes and managing high blood pressure, coronary heart disease, and chronic lung disease from tobacco use. So, sorry. Oh, sorry, okay. Yeah, from heart disease. So I'm gonna go back to, before I go to the conclusion, I'm gonna go back to how the lung and the heart interact, because it's very important. We skipped this slide. So the heart pump blood to the lungs through the pulmonary arteries. If this become damaged, narrowed, or blocked, the pressure in them increases, making it harder for the heart to pump blood through. The lung and the heart work together to oxygenate blood and deliver it to the body. The lung takes in oxygen and releases carbon dioxide, which is the ventilation, right? While the heart pumps blood through the body, delivering oxygen and picking up carbon dioxide. That's the circulation, right? The heart. And this continuous cycle ensures that all cells in the body have the oxygen they need to function. The circulatory system, which is made up with the heart and the blood vessel, support the respiratory system by bringing blood to and from the lungs. The circulatory system helps deliver nutrition and oxygen from the lung to the tissues and organ throughout the body. It also helps remove carbon dioxide. So the heart and the lungs, they work together, and one cannot live without the other, as you know. As long as you're breathing, of course, nobody gonna say, let's put this person on the ground. No. So breathing is very important. The lung is very important. That's why respiratory therapies are very important in participating in this treatment and education and diagnosis and managing the disease. So I'm gonna go to the conclusion now. While pulmonary hypertension cannot be cured, early detection, individualized care, education, team collaboration, and treatment options can help manage symptoms and slow the progression of the disease, therefore improving patient outcome and satisfaction, so patient can live longer and better life. So if you can see, the slides were short because we know your time is very precious, and we didn't want to, keep you for very, very long time. And please, thank you so much for being here. And if you have any other topic you want ARCA to bring up, please contact ARCA, and we will make sure we bring that topic to you. And any question, let us know. We are here to answer them, and we need your support to make respiratory therapy better in Africa and everywhere. So thank you all for being here.
Thank you, Ms. Binta Diallo. Thank you so much. And just like she said, ARCA's mission is to enhance respiratory therapy across the continent of Africa and the world at large. There are other international member countries that are also part of ARCA. We have Guyana, we have Jamaica, we have Pakistan and counting. So there are more countries that are joining, and they are having a unified force to support respiratory care across their countries. So kindly post your questions at the Q&A. And for the Q&A segment, I'll be supported by the Director for Advocacy and Policy. She's in the person of Dr. Ngozi Ibe. She's also a respiratory therapist, and she is going to assist us in the Q&A. So if you have any questions, kindly post it over there, and we can answer your questions for you. Thank you.
Thank you. Thank you so much, Binta. That was a very good presentation. And there are 2 questions so far on the Q&A section. Well, one, it's somebody, anonymous participant is asking, is there a certificate of webinar attendance after finished? So for that person, I will recommend that you contact Africa Respiratory Care Association at info@africaresp.org. It will be available upon request and at a cost. Okay. And another question for you, Binta, from anonymous participant said, what are the long-term complications of pulmonary hypertension?
Yeah, the long term of pulmonary hypertension, the first one is, of course, right heart failure. We talk about pulmonary heart failure is one of them. And second, I can say the long-term consequences, if we're left untreated, it's going to progress to the time that you cannot live without oxygen. You have to be on oxygen 24 hours, which is another consequences of untreated pulmonary hypertension. So you're going to live without oxygen, and later on in life, consequences is going to be affecting, of course, blood pressure all over the body, because now the heart is not working. So you're going to have not only pulmonary hypertension, but of course, systemic hypertension order. And at long term, like I said, the circulatory system going to be affected. Perfusion going to be less on the other organs. So you're going to have an organ failure. And if possible, we can have a lung transplant to help. Yeah, that's the most of the long, consequences. Long consequences.
Thank you so much.
Thank you.
The third question is really not pertaining to the presentation today, but I'm gonna read it out and maybe it said from Daniel Owusu, how are African leaders' reception of respiratory care, seeing that it is new to Africa and most of the duties are carried by RNs? So for Daniel, Ms. Dorothy, do you want to address that real quick? Or
Okay, so let me take it and then you can add something to it. So, Mr. Owusu, we have, when I say we, ARCA has been able to reach some few countries, and we are still making efforts in reaching more countries, stakeholders. When I say stakeholders, through the Ministry of Health and the Ministry of Education, as well as other key stakeholders that matter in helping start a program like respiratory therapy. So, and most of them are understanding what respiratory therapy is all about. So therefore, the reception is really great.
yeah, absolutely. Thank you so much, President Dorothy. From MK, MK. So she said, thank you for your presentation. And she's from Nigeria. And she said, I would like to know what the risk factors or causes of pulmonary hypertension are. To you, Ms. Binta. Oh, you're muted. You're muted.
Oh, thank you. I'm gonna go to my notes so I can answer you, very well. Yeah. Okay. Okay. Look like reading glasses. Good. Sorry, guys.
And okay, while she's checking, anybody, if you have any question, answer.
Okay. The pulmonary, the risk factor of pulmonary hypertension is, first of all, is high blood pressure in the arteries, which carry blood from the heart to the lung. It can be, unknown or known. So we have secondary risk factor. We have the cardiac issues, right? So the cardiac issues, that's one of the main things you can find first. The chronic obstructive pulmonary disease people especially. So, and then we have the blockage of the arteries, which are going to be damaged permanently. And that's another risk factor. And we have pulmonary embolism. Pulmonary embolism is another one at the long term. And then we have some people get the regular hypertension all the time, not only the pulmonary and also the lungs. But most of the time, COPD are a risk factor. Heart disease is a risk factor. Pulmonary embolism, another risk factor. HIV and AIDS is a risk factor. Smoking, of course, is a risk factor. And toxic drugs, some of the drugs and toxic can be a risk factor. And most of the time, too, sickle cells are another risk factor. So all that is a risk factor of getting pulmonary hypertension. That's the most common one I can list here. But there's a list, there's a lot.
Okay, thank you very much. And from the same person, MK, she said, regarding ventilatory support, your presentation noted supporting afterload. Can you elaborate what ventilator parameters can support this?
The ventilator parameter can support this is the PEEP pressure, PEEP. So decreasing the PEEP is help because high PEEP, high PEEP is going to affect the intrathoracic pressure. which will increase the pressures in the lungs. You don't want that. So we optimize the ventilator settings, making sure we use in that ventilator setting, so making sure the PEEP is lower where we're supposed to be, and we manage it by, again, doing all other assessment to make sure we're not hitting that afterload. But most of the time on the vent is to minimize the long, doing long strategies is decreasing the PEEP pressure, the end of expiration. That's the PEEP. So yeah, decreasing that, so that affect less the intrathoracic pressure. That's one of them, the main one. Yeah.
All right. Thank you so much.
You're welcome.
So there's no, for now, so if you have any questions, can you kindly post it on the Q&A section?
Yes. So, Ms. Binta Diallo, so those in the French community want a brief, just a summary of what you have said in French, just a summary, since you can speak French.
Oh, man. Okay.
That's what they are saying here.
Okay.
A summary, just put it together, a take-home message for French community.
Okay. I think I wish I was ready.
Yeah, just, something brief in your own local. If you can speak in Guinea or any local something for them, they'll be
Local,
happy.
what language they want, they can tell you.
It can be French or simple Crow English or something so that
So,
they can
ok, là, ce que je peux dire, on parlait de la tension pulmonaire et puis les traitements, la prévention et les diagnosis of, sorry, the pulmonary hypertension. So, comme vous savez, tension pulmonaire arrive dans les artères, dans les poumons, quand on a un problème de cœur. Si le cœur, si le cœur ne travaille pas bien, ne pompe pas bien le sang dans le corps, ça cause un problème dans le long. Le sang retourne dans les poumons et puis ça élève la pression. Comme ça cause, comment on appelle, hypertension. So, ce que je peux dire, comment on peut trouver, il y a beaucoup de façons de trouver. Il y a l'échocardiographies qu'on fait pour retrouver ça. Il y a le rehab qui fait 6 minutes de marche pour aussi voir si tu vas être un peu, oh man, si tu vas avoir un peu le shortness of breath. Et puis, autre thing, qu'est-ce que je peux dire encore qu'on peut faire pour retrouver ça aussi? Il y a aussi, j'ai oublié mes notes là, mes PowerPoint. Je n'ai pas les PowerPoint en face de moi pour vous dire. Mais mais le main one, c'est échocardiographie qu'on fait. C'est ce qui nous manque en Afrique. Comment retrouver les maladies là, les ressources on n'a pas, les traitements qu'on n'a pas. Et donc, ça veut dire que beaucoup de gens ont ça et ils n'arrivent pas à savoir qu'ils ont tension pulmonaire. Ils pensent qu'ils ont le systemic hypertension. Donc, ça confuse beaucoup et ça affecte beaucoup en Afrique. Et spécialement les gens qui ont, en Afrique, ça affecte surtout les gens qui ont HIV et qui ont AIDS. So, les gens qui sont séropositifs et puis qui ont tuberculose, ça les affecte beaucoup en Afrique. Par rapport dans d'autres pays qui sont affectés beaucoup qui sont affectés en Afrique par le problème de cœur. Donc, c'est les developing countries, les developed countries, like les pays qui sont développés, c'est plus souvent le problème de poumon, les maladies chroniques de poumon et les maladies chroniques du cœur. Mais chez nous, en Afrique, c'est les gens qui ont les HIV et puis qui ont les AIDS, qui ont tuberculose, qui souffrent beaucoup, qui sont beaucoup affectés par le pulmonary hypertension. Maintenant, il y a le traitement qu'on peut faire. Le traitement, il y a des il y a des médicaments pharmaceutiques et il y a les médicaments non pharmaceutiques. qu'on utilise pour soigner pulmonary hypertension ou bien pulmonary hypertension pulmonaire. Sorry. So, les traitements options qu'on a, je ne sais pas pour le moment en Afrique, mais ici, c'est que je disais, on a les nitric oxide qu'on utilise ici pour l'oxygène. Et puis, il y a beaucoup aussi de heart medication. Ça, c'est utilisé par les nurses. On ne les utilise pas. Nous, on utilise les oxygènes en général. Nous, les thérapeutes, respiratory therapists. Et puis, il y a aussi, qu'est-ce que je liste aussi sur la liste là-bas? Je n'ai pas ça en tête parce que je n'ai pas les slides devant moi. Mais beaucoup de traitements, c'est oxygène thérapie, ça aide. Et c'est qu'on nous manque en Afrique. Et puis, il y a les inotropes medication, les médications de high blood pressure aussi qu'on utilise. Mais plus souvent, il faut soigner d'abord la cause, la maladie qui a causé la tension pulmonaire. C'est la maladie là qu'on doit d'abord soigner avant d'attaquer la tension pulmonaire. C'est ça qui aide plus. Et en conclusion, je disais comment on peut prévenir la maladie. On peut utiliser aussi, changer notre façon de vivre. On peut changer la façon dont on mange. Il faut qu'on se lève un peu pour marcher, changer le lifestyle. Et puis on marche, on change nos manger et puis on regarde notre blood pressure. Si on a high blood pressure, il faut qu'on prenne des médicaments, il faut qu'on manage ça et pour ne pas que ça affecte le poumon ou affecte le cœur à la longue. Parce que ce qui affecte nos cœurs, notre cœur, ça affecte nos poumons, sorry. Donc, les deux vont ensemble, les poumons et le long, parce que le cœur envoie le sang dans le poumon. Et le poumon oxygénate le sang pour ramener ça au cœur et puis pour ramener ça dans tout le corps. So, les deux travaillent ensemble et c'est très important qu'on a un cœur sain. Et puis, des poumons aussi, la même chose, healthy. So, qu'est-ce que encore j'ai dit? Sorry, désolée, je ne me suis pas préparée pour ça, pour parler en français. J'allais faire 2 slides pour vous, mais j'essaierai de faire et puis importer ça dans notre ARCA. Mais aussi, j'ai parlé de la conclusion à la fin. On ne peut pas soigner la tension pulmonaire, mais on peut pas soigner, mais on peut faire tout pour aider les patients à vivre avec. Par éducation, on va éduquer les patients comment faire et puis on va manager les maladies. Ils vont aller au pulmonary rehab. Il y a les réhabilitations qu'on peut faire pour les apprendre à vivre avec la maladie, diminuer leur oxygène consomption et puis diminuer aussi peut-être le use of, comment on appelle ça, de médicaments et tout ça là pour pouvoir vivre avec la maladie, pour pouvoir marcher avec et vivre une longue vie et puis qui n'est pas trop, souffrante. OK? Je peux utiliser ça comme ça. Donc, en fait, c'est ça que j'ai parlé ici. J'ai parlé de la tension pulmonaire, comment on trouve ça et comment on soigne ça et comment on peut vivre avec. On n'a pas pu faire beaucoup de... J'ai fait recherche, mais pas beaucoup parce qu'on ne pouvait pas prendre beaucoup de votre temps. Et il y a beaucoup d'informations qu'on pouvait envoyer ici. Mais comme c'est la première fois, on a fait un peu. Et prochainement, j'espère qu'on va vous envoyer ça aussi. Et puis en français. Et on est en train d'essayer aussi d'involver tous les pays anglophones, francophones. ARCA est en train de faire ça, mais pour le moment, on s'excuse beaucoup parce que toutes nos présentations, c'est en anglais. Et je vous remercie aussi. Merci beaucoup. J'espère que j'ai pu vous donner un peu une idée. Merci.
Right.
Merci beaucoup, merci beaucoup.
De rien.
C'est un plaisir.
S'il vous plaît, je pense que Binta est devenue très anglophone qu'elle ne doit même plus mettre pied en Guinée ici.
Non, 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 non.
Voilà.
Pour Sandy, Sandy. Pour Sandy, tu devais présenter. C'est toi qui dois présenter ça. Pas moi.
Il n'y a pas de problème, je
Thank
suis très
you.
bien de la présentation.
Non, je vais
Merci
essayer
beaucoup.
maintenant.
Peut-être ce que je pouvais ajouter sur ce que tu es en train de dire
Merci.
pour tous ceux qui sont là comme les francophones, comme elle était en train de dire pour ma connaissance, c'est que l'hypertension pulmonaire, c'est effectivement l'augmentation de la pression au niveau du poumon. Peut-être lorsque le cœur n'arrive plus en réalité à fonctionner de façon adéquate comme habituellement. Comme nous le savons tous, c'est que la fonction réelle du cœur, c'est l'expulsion du sang vers en réalité les organes pour leur fonctionnement. Et au retour, il faut que le sang qui a été expulsé pour le fonctionnement fasse un retour vers le cœur en allant au poumon pour les échanges gazeux. En réalité, si le cœur là ne fonctionne plus, ça va entraîner une pression augmentée, n'est-ce pas, au niveau du poumon, comme elle était en train de dire. Maintenant, pour rapidement toucher, comment on appelle, les éléments sur lesquels on peut se baser pour gérer ces situations, c'est vrai qu'on ne peut pas trop s'ajarder par rapport à la prise en charge. On fait avec, comme elle a dit, mais à ce qu'elle a dit, je pourrais ajouter un peu les exercices physiques qui sont contrôlés ou alors sur la supervision médicale. Et le régime alimentaire également qui pourrait être un élément très capital. Il faut vraiment suivre un régime équilibré qui est pauvre en sel, voilà, en sodium, comme vous le savez. Ces éléments-là sont source, en réalité, quand on est hypertendu, le sel n'est pas encore un élément qui soit très apprécié. Donc, il faut également faire un contrôle régulier du poids, un IMC, c'est-à-dire indice de masse corporelle qui soit raisonnable, parce que nous le savons tous, partout où on parle de l'hypertension, que ce soit pulmonaire ou artérielle. En tout cas, la sédentarité n'est pas une bonne chose qui soit indiquée. Voilà un peu pour les éléments que je pouvais ajouter, même si elle n'a pas présenté en français. Mais désormais, elle va le faire pour ne pas que nous arrivions là. Donc, Binta, merci pour la présentation.
Thank you so much. Et il faut
Voilà.
faire attention
Thank you.
et la fatigue. Ça, c'est les signes plus souvent.
Voilà, exactement.
Merci, Sandy. Merci beaucoup.
Merci, Sandy. Merci,
exactement.
Sandy,
donc, le fait que vous n'avez pas fait une présentation en français, ça fait que la communication est un peu difficile.
Oui, mais on va essayer.
Beaucoup.
On va essayer.
Okay.
Thank you, Sandy. Merci beaucoup.
Merci.
Ms. Binta, you have to translate for us.
Oh, no, he just said thank you. And he just said whatever I said. He added some, and then he said thank you to all. He said next time, hopefully, because it was not in French, it was a little bit difficult. But hopefully, next time we can present in French.
Yeah, so ARCA is doing its best to ensure that language is not a barrier in our webinar series. So we look forward to the subsequent webinar series, having more interactive sessions in our various languages in Africa. Africa is indeed diverse, so ARCA is doing its best to ensure that
I also say that Binta is not going to come back in Guinea because it's very difficult for her now to speak.
Don't worry, we'll talk about it.
French.
We'll talk about it later. So we would have to move on. Thank you, merci beaucoup. And I would give it to the Director of Advocacy to continue with Q&A.
Okay. Yeah. Thank you.
Yes.
All right. So there's one more. Okay, two more. The next question says from anonymous participant, what effect does milrinone have in treating pulmonary hypertension?
What effect on what?
Does this medication, milrinone?
Milrinone?
Mm-hmm.
What is milrinone?
I want to come in here. Milrinone.
Milrinone. Okay.
Yes, actually helps with the, reduce the symptoms and side effects. But ARCA is not promoting its members or participants to go and do self-medication. We are giving the education for you to be aware. Okay, so for medication side or pharmacological side, you have to contact your doctor to give you more details on what to do or how to manage in terms of treatments with medication. Thank you.
All right. From Okechukwu Chinyere Eke said, oh, okay. Will you be sending the presentation for those who missed it?
Okay, so thank you for that question. So what ARCA is doing now is that we have introduced the YouTube channel. So the educative part of the session that we had would be recorded and posted in the ARCA YouTube channel. So in the announcement session, I'm going to post a link for you to see, or a short video for you to see where to go. So when you go on YouTube, you can just type Africa Respiratory Care Association. We've started working on uploading most of the events that have occurred on YouTube so that people can easily access webinars. So IT team is working tirelessly on that to ensure that you don't miss any educative part of our series. Thank you.
Thank you. From Daniel also, he's asking about ARCA. He said, what is this organization doing to raise awareness of respiratory therapists in Africa, and what resources are needed for this to happen? So
okay, so Dr. Ngozi, take that.
I think Daniel, I feel like we might have to have like a meeting separate from this so we can really talk about ARCA, because he's the one that brought up the first question concerning ARCA. That would be so that you'll be well informed. I think that would be the best option to go. But ARCA is doing a lot of stakeholder engagement, just like President Dorothy had mentioned before. These webinars are also meant to create awareness as well on who respiratory therapists are. And that's why we're doing the webinars. Very soon, we are going to start podcasts. And then we're doing, the country directors are doing great in engaging stakeholders in the various countries. But we can talk more on that. Actually, you can reach out to Africa Respiratory Care on info.africarest.com. And we can maybe set up a meeting or something, then we can really elaborate on that. Okay, Daniel?
Okay, and also to add to it, Daniel, you can visit us on www.africaresp.org. Most of the questions that you're asking is on the website, so you can get more information about what the Africa Respiratory Care Association is doing currently. Thank you very much.
Thank you. And okay, that's no more questions
Okay.
for now.
Okay, so if we don't have more questions coming up, I'm projecting our survey. So in a way, or in the bid to promote respiratory therapy across Africa, ARCA is embarking on a survey which is titled Validation of the Respiratory Therapist or the Respiratory Therapy Profession for Africa Healthcare System. So Daniel, also this would answer your question. We want to know whether you indeed really would want respiratory therapists in your country. So this survey, if you are French, kindly scan the QR code for French, and if you speak English, kindly scan the QR code in English and then fill out a 1 to 2 minute survey. That will greatly benefit ARCA to get responses. So this would help us know what the people are saying, what you are saying, what you want, and how we can engage our stakeholders in ensuring that respiratory therapy profession is known in your countries.
And
So
I'm sorry, just to stress on what you just said. So this survey is not for, if you're a respiratory therapist, it's not for you. But what you can do is to actually share it with other healthcare practitioners. And it doesn't really have to be only healthcare. Actually, it can be school administrators. When they have this asthma and all of that, they might be interested in knowing more about respiratory therapy. So it depends, wherever you are, any country at all. Just share it with other people around to see what they say and if there's a need. We want to see a needs assessment for respiratory therapy. Because if you say respiratory therapist to complete it, it's going to be biased. We already know we are good, more than good.
we can't praise ourselves, but we want the non-respiratory therapist, whether you are a doctor, you are a pulmonologist here, you are a pharmacist here, you are a physiotherapist, you are occupational therapist, you are a nurse.
Yeah.
I mean, any person, any health personnel that you are, or you are a hospital administrator or policy maker, or you are a minister of health or
Yeah.
minister of education, or you are somebody who has respiratory health at heart and you are listening to us, this is a survey for you. Just 1 to 2 minutes. We want to know what you think about the profession coming to Africa or expanding in Africa. So I will leave it on the screen for a while. You can use your phones to screenshot or use your laptops to screenshot, or whichever device you are connected with, screenshot it so that after that you can scan the QR code, fill out the survey, and we would know your responses. Thank you so much. Thank you so much. And thank you, Ms. Binta, for an excellent presentation. And thank you for also presenting in French. So this helps our Francophone brothers and sisters to feel more participative or to feel part of it. And please, for our Francophone brothers and sisters, moving on, as I said, we will try our best possible to ensure that you are not deficient in the language translation. So ARCA will try its best to work on language translation in subsequent webinars.
Yeah, thank you.
And if you're a translator and you want to join the Africa Respiratory Care Association, this is an opportunity to support the Africa Respiratory Care Association with what you do. That way you can translate various languages for us as we present our webinars. So this is an appeal to any Francophone speaking person, Portuguese speaking person participating on this webinar series. If you can understand English and also translate in the language that you know, kindly let us know at info@africaresp.org. Thank you.
Okay, Daniel. Daniel also said, let's see, are there compensation mechanisms in place for RT education in Africa? If we educate people, how will they gain employment after completion?
Okay,
Again,
so Daniel also, so contact africaresp.org and then we can address these questions for you because we need to give you a lot of information. So contact africaresp info at africaresp.org and I'll attend to you. Thank you.
Hello, can you hear me?
Yes, Daniel.
Okay. Yeah, thanks for addressing my questions. And Binta, thank you very much for the presentation. I think you did a great job. I worked with Inova before as a respiratory therapist, so I know what, how the whole thing goes. Pretty awesome.
Thank you.
Yes, I'm asking these questions because we had over 50 something people online, and it's not only for my own information, but also for everyone else on the line, and maybe people who might be able to get information out to others, so we can, expand the role and the professional respiratory around the world. Now, starting Africa is great. I was in Ghana a couple years ago. I went to Confanochi Hospital to do some few stuff. And I spoke to some of the other residents, and we were discussing things about CPR and other stuff. Now, Africa, as we know, we are very much into getting the theory part done. Africans can study very well. You put a book, they can study, but then when it comes to the practical, sometimes a little bit of a challenge. So I did ask them, okay, if someone is having cardiac arrest, what do you do? And the resident, they were able to show me the whole process of going to the CPR, check the. And then the question is, okay, would they be able to do the same thing when there's an actual patient arresting, getting to cardiac arrest or getting some form of pulmonary issues? This is where the education part comes in. And with respiratory therapists, we are able to get respiratory therapists on board. I think is great. So the education part, the reason I was asking, yes, we can educate, but when they finish, will they be able to gain meaningful employment in Africa, or are we just going to educate them and then from there, what happens? Here in the United States, when you go to respiratory school, yes, when you finish, respiratory therapists are in high demand right now. We can get jobs almost anywhere. But can we replicate the same thing in
Okay.
Africa?
Can I answer your question, please?
Yeah.
Okay, so in Ghana, respiratory therapy program has started, and I'm a pioneer or a product of University of Ghana respiratory therapy program. Okay, so this program that you're talking about has started, and Komfanoji Teaching Hospital also has respiratory therapists over there. Perhaps the team that you met couldn't let you know who they are and what they do, but we have respiratory therapists in Ghana, we have respiratory therapists in Egypt, we have respiratory therapists in Liberia, and other countries in Africa are waking up to this profession. So if for the information and for everyone, respiratory therapy has started in Africa and it started in Ghana with a bachelor's degree program. So that is why we're saying, if you want more information, contact the Africa Respiratory Care Association at info@africareps.org. And to be a part of this or to support the respiratory therapy professional program in Ghana or in Africa, to say, you can join the Africa Respiratory Care Association on www.africaresp.org, or when you go on the website, just Africa Respiratory Care Association, and you join, you would at least join this workforce or join this strong advocacy group that would help channel our quest to our stakeholders. So there are respiratory therapists that have been trained, that are even in school and the training, that have also gotten jobs in the country. So there is more to your question that you're asking. So kindly reach us and then we can help you. Thank you very much. Please, if any other person has a question related to this, kindly reach us at info@africaresp.org or join ARCA at www.Africa Respiratory Care Association, and you can join the workforce. There are pulmonologists there, there are doctors there, there are lots of clinicians there that would help you. And the team of executives in ARCA would be ready to assist and give you all the information that you need. Thank you, Daniel, also for this information. Any more questions, please? Any more questions, please?
I think the last question was, I had sent a reply back though, but it was the first question we had about having a certificate. So for anybody that have the same questions about certificate, it is available upon request and at a cost. So, but we recommend that you contact the ARCA at info.africaresp.org. Okay, info@africaresp.org. Thank you very much.
Thank you all so much. And I will also want to say that this webinar series has been proudly or is proudly sponsored by Zopec Medical. Zopec Medical is a company that produces UPS batteries that supports the mobility of critically ill patients from one unit to another or from one facility to another, be it air transport, water transport, or by the sea, or any form of transport. And even if you want to walk your patient or ensure early mobility, their batteries come in handy to support all the electrical equipment that you have supporting the patient or giving care to the patient. So if you are in Africa or outside Africa, or you can reach us at info@africareps.org. But if you're in Africa and you want a direct agent to speak with you, you can contact this number +277 66 233 2941, and the email that I have displayed. And then they would help you. So if you're in Ghana, you are in Nigeria, you are in Angola, you are in any part of the world that you are, you can reach us. And then you can also contact, as I always say, contact the africaresp.org. Or you can also WhatsApp +233 54923 9673. And then put your request there regarding the batteries, and we will send you the appropriate persons that can assist you. So on that note, we want to say a big thank you to all of you for making time to participate in today's webinar. Africa is proud of you. ARCA is proud of you. We are all making the change. And in these webinars, we are promoting and ensuring that at least respiratory health is discussed. And we are also introducing the role of respiratory therapy through our webinar series. Thank you all so much. And we look forward to our next webinar.